If fear is an overall thing, it's causing stress, and that can actually make you look older. So if it's that fearful, we don't need to do it today.
Mm.
And it's interesting when I let them know that they have the ability to walk, to leave, that we don't have to proceed, they relax.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Shelia Anderson, who has a passion for providing full face assessments for her patients to help them identify what is their stress in life. In 2021, after 28 years in the Seattle area, Sheila returned to the East Coast to be closer to family and find the sun. Teaching is important to her, so through Allergan Medical Institute and Titan Education, she helps those interested in becoming an injector. Sheila divides her time between Louisville Laser and Aesthetics in Louisville, North Carolina, and Keys Med Spa in Key West, Florida. So Sheila, welcome and glad to have you here.
Okay, thanks, Daniel. I appreciate you letting me come.
Yeah, so let's dive right into it. How did you get interested in aesthetics?
Oh man, see, I'm one of the geriatric ones, so I forgot to put that on my resume. So I was back in the 90s where we actually injected bovine collagen. That's all it was. So I was an intensive care nurse.
Mhm.
And I love it was like a puzzle. You were always trying to stay one step ahead and make sure the patient was safe and that you caught anything going wrong. And then, politics got in and unions and everything. And then when I moved to Seattle, it was a plastic surgeon that needed some help in the OR and in recovery. And he was on faculty at the University of Washington. So he did studies, and one of the things that he needed was an injector. So in that day, I got my collagen specialist license, and then I kind of just became part of that team. And it was so amazing because now patients would pay me to hurt them. So I was one of the first that actually we were using Botox in the therapeutic world, but there was no rules or regulations in the cosmetic. So we're using it off label. And so the patients, I mean, it's a beautiful way to start because it doesn't last long if you mess up. But it was such a great way to introduce and to meet people in their element and to help them feel a little bit better. But I was at the beginning, and now we have so much more in our pocket. And the reason I love it is like, as you know, the pandemic, everything, life takes us down. And it's like we just need to look the best of our best. It's not that we want to look like someone on TikTok or we want to look younger. It's just what can I do to make me look a little bit better and feel better? And that's the part that I love.
Got it. Now, can you discuss some of the most popular treatments that your patients come to you for, and also why do you think they're so popular?
Well, I think one of the things is the neuromodulators, and I prefer Botox Cosmetic. We have 5 in the categories now, and number 6 just got approved. But I think that is one because it's more of a preventative. What it does is slows down the motion. It doesn't do like Christmas with the Cranks and Tim Allen, where the face is weird and frozen and weird. That was just the joke of it. But what it does is helps people look more relaxed. So, like, if people, salesmen, for example, they did a study and they showed the sales increase with the use of Botox just in the glabella area, which is between the brows, because now they didn't frown as much. And so it just helped them look more relaxing. The other option, and we're seeing people, Daniel, start in their late 20s, early 30s now as a preventative. And I think it's like they look at their mom and dad and it's like, baby, I love you, but I don't want to look like you.
Mhm.
And so I think that's the reason that's important. The other one is our fillers slash, and I hate the word fillers because fillers almost sound like we're going to make you fat and puffy. But now we have moved into products that provide structure and to replace the volume we've lost. So
Mhm.
if you think about it, God really didn't invent us to live till we were 30. And then when you're over 30, you start looking kind of rough. And I said, God, why do we look so bad? And he said, Sheila, I thought you was going to die at 30. You're living longer. I sent you products to use it and be quiet. And I think that's the main thing. You see some bad jobs out there. And
Mhm.
I don't know, is it the provider? It's not really the patient as much, but I think it's the provider. And that's where my passion for education comes in, because I can tell you, being one of the first, we didn't have anybody to help us. We had to figure it out.
Hmm. Yeah, it's been quite a journey you've gone through, and I know that I talked to a lot of other people, and they didn't have the training in the beginning. The newer ones had the training, the support, but the ones that had been in a long time, they never had that training.
No, no. And it was hard. You learn by the school of hard knocks.
Hmm.
And that's hard. It's slow.
Hmm. Yeah. Now you talked about one of the new neuromodulators that came out. Are there any other new or emerging treatments that you're particularly excited about?
Even though we have been doing treatments for years and years and years, there's new FDA approval indications. And the reason that I love that is because now I get the science and more in depth knowledge and information. So, for example, temple filler is one we've been doing forever, but it's a high risk. Blindness can occur from that. So again, my more novice injectors that I'm training, they have to understand anatomy. But that indication is coming. It will be here. We'll start teaching on it in September.
Mm.
And so I think we'll see a big boom with that because people are already doing it, but they're doing it poorly. So I think with that education, it's going to really help us balance the face. For example, a woman needs a concavity in the temple area, and a man needs a fullness. That's a masculine and feminine traits. But if you don't understand, you just put stuff there and then you change that sexual dimorphism, and it's not it doesn't look right.
Got it.
That was coming. Also, as old people get these lines on our neck, we call them platysmal bands, and we've been treating them forever. And it's a huge depressor muscle for the face, so it's pulling the face down. And that indication should be coming at the end of this year too. Those are just, we've been doing them. It's the same product, but now we'll have more education and we'll get better outcomes. So those two, I'm super excited.
Got it. Now, I'd like to dive a little bit deeper into how do you differentiate yourself from others in the industry? You mentioned before that you've been in the industry a long, long time, so you know what you're doing, but what other differentiators would you say about yourself that separates you from others?
As you can tell, I'm not an Insta famous girl. You'll never find my picture with a bikini on my Instagram photos. It would be scary. It'd be a great one for Halloween. And I think mine is not about notoriety. If you follow me on Instagram, you're going to find more education. My patients will find me, and it's by word of mouth. That's my biggest thing for patients to find me. But I'm more on education. I want to educate the patient. For example, I did a training. I was just in Los Angeles yesterday, and we had a model that came in, and he was under the assumption that we could only fix a line. And so that's what he wanted fixed. But he didn't understand the reason the line was there. So I love to take that opportunity to educate the patient. As we age, or sometimes it's just the way that genetically that we're made, we may have some loss of volume, bone, or fat, and correcting that will now correct the symptom, which was the line. So the education of the patient, you see their eyes just pop once they understand. And I think that's my biggest thing. It's not about how much money do I make an hour. It's not about how much product do I move. It's not about seeing 40 patients a day. I just want to make the connection and educate the patient and then have them to look like their natural self. That's my passion, backwards and forwards.
Got it. Now, you touched on this about educating your patient. Now, when it comes to your approach of educating your patient, how do you approach this? Because I'm sure you get some people who think they know what they need, some people who know what they need, and others who are like, they have no idea what they need. So how do you approach those situations for the different type of patient and all those different scenarios they can come to you with?
Well, a lot of times when they come in for the appointment, they'll be booked. So they're booked with a neuromodulator, they're booked with a filler. And then I ask them, tell me the top 3 things you'd like to see during our appointment and talk about. So they open the door. And then if they're in a hurry, it's like, Daniel, you come in and you've got 10 minutes and you need to get out of my door in 10 minutes. I know that, and we have to do what we're doing and go. And then, so with you, I would ask, oh, Daniel, do you mind next time when you make an appointment, if we can have an extra few minutes, then we can talk about some other aspects that we could work on in order to help keep you looking your best of your best. You look pretty darn good. So it's kind of more like, are they willing and open? I spent 30 minutes working with a lady, and she was, what I could do with her, Daniel, I was watching her face and I was like, oh my God, I was so excited. And all she wanted me to do was to correct a line on her lip. And it was very sad. That's what we ended up doing. That was what she wanted. But then I did let her know if she decided at any time that we could correct what's causing the line. So it has to be both ways. I have to have the knowledge and I give them the assessment, but it has to be what they choose to do as well.
Got it. Now, we've talked a little bit about the treatments and how these different treatments work. How would you say, from kind of like a higher level, for those who don't know, how a medical spa treatment differs from your traditional cosmetic surgery treatment?
Well, cosmetic surgery, you're traditionally going in there and now you're thinking surgery. So it's like we know that that's where we're going to start. The medical spa is a little bit more laid back and relaxing. You don't have the sterility. You don't have the policies and procedures and all the forms and the scary part of it. You're not sitting in a waiting room with people with bandages over their face. So it's more of a calm, relaxing environment. Most med spas do incorporate facial treatments as well for the skin, some for the body. And you may find that in a cosmetic surgery and you may not. So that difference. The key is that as a medical provider, if you come in to see me, I need to be able to offer you all the options available. So even though I'm in a med spa, if I feel like you would have a better outcome with surgery, I need to mention that to you and allow that as an option. And that's one sad thing I am seeing, is that some places will only offer what they have. So the patient has spent $10,000 to $15,000 and they're not happy because it wasn't the right treatment. So I think the professionalism of the medical aesthetics has to start there. We have to give patients all our options. So, and you've got to admit, would you be more comfortable walking to a more relaxed space, or do you want to walk into the sterility and see the dressings and everything? It's just what the patient's looking for.
Got it. Now, we talked a little bit about having patients that come in that they think they know what they need, or they know what they need, or they don't know what they need. What would you say are some very common misconceptions you see about the types of treatments you provide?
So one, I'll give you a great analogy. So I had a guy come in and he was a professor at University of Washington in Seattle. And he said, I really need Botox. And I have these lines on my mouth and I need Botox for that. So we started talking because it was a very unusual presentation. It's like there was a lot of volume loss in that specific area. So as I started going through the assessment and digging through, the dude had fell and hit his face against the step in his house and had totally decided not to go to the emergency room, so had gotten tape and taped his skin together. So this has been, I know he didn't like doctors, but he came to see me. And then it was so funny because being in trauma and working in the operating room, I know that once fat has had some type of trauma, then you lose the fat, it dies. And so his presentation was not for Botox, which is related to muscle strength. It was actually related to the fat death and loss of volume from his fall 2 years before. So I was thankful he was able to open. I could have added Botox to his lip. He would have hated me in 2 weeks because he wouldn't have been able to talk when he was teaching. But that's why I think it's so important. And honestly, Daniel, here's my thing. If he doesn't understand and want to follow my instructions, I have the right to either not treat, because my goal, when you pay me money, I want you to look better and feel better. Because I could have taken his money, but you know what would have happened in 2 weeks? He would be cussing me. I think, that's where I love the education part. Now, I do have a few, Daniel, that come in and it's lips. I saw this on Instagram. This is what I need. And I know that I could charge them the money and put product in their lips, but they're going to look ridiculous. They're going to look like Marge Simpson. And that's where I say no. I offer them an alternative. A lot of times when you add support and structure to the lower face, the lips are more supported. That might be what they need. So, and if they don't like my suggestions, then, they will go find somebody that will do it. That's what's beautiful about this industry. If you really know what you want, there's somebody that will do it.
Yeah. No, I think that's a very good point that you bring up as far as everyone has these misconceptions of, oh, I saw this on Instagram, I saw this on TikTok, make me
Yeah.
look just like this. But in reality, that's not always going to be the best solution for them, or it's not going to be possible for them. And
No, and
it's,
it's so funny. You know how many people use filters?
oh yeah,
And it's like, what do they really look like?
yeah.
So I know. So it's really interesting.
Yeah. Now, when it comes to that, like, how do you provide that or make that balance between providing that relaxing experience for the patient, but also at the same time ensuring their safety and well-being?
Well, education, I think, and discussing is the main thing. I study all the time. I just finished a cadaver course about 3 months ago, and I've been injecting since 1995. So I try to stay very current on understanding and anatomy and physiology, and then to keep the patient comfortable. There are people that are scared to death.
Mm,
And so we have to know, if fear is an overall thing, it's causing stress, and that can actually make you look older. So if it's that fearful, we don't need to do it today.
mm,
And it's interesting when I let them know that they have the ability to walk, to leave, that we don't have to proceed, they relax.
mm,
So, and I think talking them through and understanding, and I think them knowing that I'm not going to take them to the edge of the world and make them look like some weird alien. But again, if they're not comfortable, we don't do treatment that today. We may just talk. We may be discussing what they're looking for. But if that fear is there, I won't go there.
mm. Yeah, I think that's great, that telling them what's going to happen, and that's what makes them feel comfortable. It's not necessarily something physical like, oh, a comfortable chair or a nice environment. This is what's going to happen. And from there, when they know what's coming, they're more relaxed.
Yes. And some of the procedures, there'll be a little pinch, a little scratch. But if there's severe pain, I'm in the wrong place. It's not supposed to be that way. And when they hear that severe pain is not part of the treatment, they kind of relax. Because I want to tell you, Daniel, have you ever watched The Desperate Housewives? They put on numbing cream for an hour and they scream. They scream when they get these baby needles put in. Well, they do that for attention and because they're on TV.
Mhm.
You don't, and I am Southern Baptist. So I always tell people, if I hurt you, God will hurt me back. And that's something that I do not like is pain.
Mhm.
So sometimes it's like they understand that I resonate with them. I'm not a fan of pain. So we're not going to go down that path.
Got it. Now, when it comes to medicine, people always think that it's a process, there's a protocol, there's a procedure. But what role would you say that creativity plays in how you approach patient care?
The protocol, policy, procedure, all of that is a safety issue. That's where that goes. The creativity is more in the aesthetic eye of the injector. And I hate to tell you this, you can't teach that. It's almost inbred. So I would like to farm myself out to some of the clinics because I can work with someone who wants to be an injector and within 10 minutes tell you if they're going to be they have the creative eye and they can see, or if they're going to be a mediocre, okay, cookie cutter provide treatment. So you can't teach the aesthetic eye.
Got it. Now, throughout your experience, I'm sure you've had some particularly challenging cases that you've come across. Could you talk about maybe one story where it was a really tough case and how you were able to get them a successful outcome?
Yeah, so when I first began, I worked with a plastic surgeon. So we did a lot of trauma. Patients had been in accidents. We had several that had surgery or there was something wrong. So I was always drawn to that medical side where, they've done everything they can for a patient.
Mm-hmm.
I had one patient that was so interesting. She had Bell's palsy. So Bell's palsy is a neurological, but a lot of times you're left with residual, where one side of the face is super active and the other side is almost flaccid. So the face is trying to balance, but what we try to do is to balance the face. Like, for example, when she smiled, one of her eyes would stay more open, the other eye would come to a slit. When she would smile, one side of the mouth would go up really high and the other would not. So it did take us about 6 months because we worked on what would come, and The beautiful thing about Botox Cosmetic, you can work little bits and then continue to add. It's not like, oh, we're going to do this and it's like surgery and you're stuck this way. The same thing with fillers. So we were able to work back and forth to where when she was able to smile, she was happy. And to me, that just lit up my heart. It was like, just something simple as being able to go to a family reunion and smile with your family and have a picture that you're not ashamed of. So those were really happy.
Yeah. And I think it's very telling, like the stories that you saw as some of your toughest but most rewarding is actually people that just want to look normal. It's not, oh, I want to look like the most beautiful person in the world. It's just, I just want to look normal.
Exactly. That's what it is. I don't have a lot that want to be the most beautiful in the world, but most of those, Daniel, have to go to a psychiatrist. I'm just saying, I'm not skilled in that area.
Yeah. So, but I think that's the thing that people kind of miss out when it comes to the aesthetic industry. They think it's just about vanity. It's just about looking like the Instagram models. But in most cases, it's not that. It's just people that want to feel comfortable in their own skin and who they are.
Exactly. And there are a few fads out there. I mean, we went through the Russian lip fad, and that's going away, thank God. So there's little fads that come and go, but most of it is just normal people who just want to look a little bit better.
Yeah. Now, I want to shift tracks a little bit. I want to talk a little bit more about your training, your education. So could you talk a little bit more about that? Like teaching is your passion, and like you like to share education among your colleagues and also people who are new to the industry. So could you talk a little bit more about that?
Yeah, so I work with Kevin Harrington with Titan Aesthetics, and we do a program called Teaching Your Brain How to Inject. So this is for people who, I really think I want to be an injector, but I'm working in this field. Is it really for me? So this is great. It's 6 weeks of foundational knowledge that we do online. And it's a great course to get in and understand the whys behind it. And then if you're ready to proceed, then there's a placement agency with Titan Recruiting that actually can help place you. The next level I work with Allergan with the AMI, and we start with baby injectors that's never injected before. I just did a training in LA and with more experienced injectors that they were happy, but they wanted to take it to the next level. So we'd had a new product released last year called Botox, and it really kicks butt, but it's a little bit of a different monster. So we have to learn how to play with those boys. So we were actually working on different techniques, and she was so excited to kind of get those techniques and go to that next level. And I'll have to be honest with you, I let everyone know that I am a little bit older. Like I said, I started at the beginning. So when I go to the nursing home, they all have to take turns to make sure I look good when I'm there. I know. See, there's the selfish side to my education. There's the selfish side.
Yeah. Well, I think overall, just your passion for it and also the reason why, because that's why I hear a lot of people that teach. It's like, hey, when I started, I didn't have any of this support. I had to figure it out on my own.
Yeah, it would be so interesting. I would inject someone and I'd always see them in 2 weeks when Botox was there, but we didn't know what we were doing, seriously. And then when the patient come in, it's like, I'd have to figure out, now, why did I get that response? The why became my mission in life. And that's how we learned. And we would talk to a girlfriend or a doctor that was doing injections, but it was interesting, and I still find it to this day, they don't want to share. And I hate that. So I actually had a physician that I had to leave because I was teaching my peers. And he said, Shelia, you're educating my competition. You can't teach anymore. So I gave him my resignation that day. Because in nursing, one of our main objectives, we share information and knowledge so we have better outcomes for our patient. And I live by that. That's on my business card. And it's like, if you're not going to allow me to continue that journey, we don't work together anymore. So that is the one thing I think which will make our profession so much stronger and better.
Got it. Now, Shelia, where do you think the future of aesthetics is going?
Oh my God, Daniel, I wish I could get reincarnated real quick because it is going to be super cool. I think there's going to be some type of injectable that's going to completely rejuvenize the skin. It's going to take the DNA that's been damaged through the years and reverse it. One of the biggest things with facial aesthetics is we are losing bone because the structure of the skull we're losing. So I think there's going to be something that comes that will help us slow down that process. Like I said, I wish I could get another lifetime because it's just beginning. I mean, we started in 1980s. We had cow collagen, and look at us now. And that's it. It's just booming. Every week there's something new. There's a new technique. And it's just, I think we are living longer. Not that I wanted to be 120, but if I am 120, I don't want to look like I am. So I think that impetus is going that way. And I think it's going to be less invasive. You know, surgery might become a thing of the past, because with surgery, there's pain, there's a lot of risk, and then there's healing time. So I think you're going to see the non-invasive of aesthetic medicine take off. And I can't wait. I know. I just hope I'm still here to see it.
Yeah. Well, I have one last question for you, Shelia, but before I ask it, I want to point people to your website at www.louisvillelaser.com, and also for your other practice, www.keysmedspa.com. Now, the last question is, what would you say is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Do your homework. Number one is really the best by word of mouth. Find somebody who's done it. Now, the problem is it depends on the area of the country. I have to say the Southeast is bad. It's like, oh no, girl, I don't do anything. I look this good naturally. But there will be someone to share, and that read the reviews. Google reviews are amazing. I hate to say it, but Instagram, there's so many people that know how to get the bots to say stuff and all. You know, you kind of can get an idea of the portfolio. If you go to my Instagram, you're not going to find a lot of before and afters, because honestly, my patients are very private and they don't want their picture posted, and I will not do that. But I think word of mouth, Google reviews, and to kind of do research and look at what the patient, what kind of patients the person's treating. If someone is like treating lips and they're 20-year-olds and it's all you see on their Instagram page, and you're 40s, you're not going to go to that person because that's all they know how to do. So find someone that's treating the age you are and you're seeing good outcomes. And then, like I said, the reviews. You can also go to the different websites, which are not that great, but other providers. I know Allergan.com has a find a doctor. So, but again, that's more random. It's not really finding the provider. Does that help? I know it's hard. It's a hard journey. And always book yourself a consult. So when you go in, if the person's like, yeah, what we're doing today, and they have you in your chair and you're done before the door closes, stop. You don't want treatment there. They need to offer you an assessment. You know, listen to what you have concerns about, but also tell you what they can see that would provide you the best outcomes. If they don't know, you don't want them to put a needle in your face.
Got it. Well, there you have it. Shelia sharing her expertise. Now, Shelia, where can people contact you?
So I am FaceTime by Shelia is probably the best. The two websites you gave are the clinics that I work, and they have my books open. So that's probably the best way. So FaceTime by Shelia. And like you said, I spell my name weird. It's Shalia. But DMs there would be amazing. And, you know, I love to talk. You can tell that, can't you?
Yeah.
Yeah, unfortunately, yeah.
Well, great. Well, thanks for being on the show and sharing your message.
Okay, thank you, Daniel. I appreciate the opportunity.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.